So good evening, everyone. Myself, Dr. Tanima Singhal, and I welcome you all on today's Q&A session. So let's start the question. So hi, Rinki. Hello, Rekha. So baby is not gaining weight. So baby is not gaining weight. Just let me know. Just let me know. Is the baby on formula milk? Is the baby taking baby's 3 months old? Okay. Write more so that I understand. Till you write properly so that I understand how much formula the baby is taking, what all thing is happening. Just write that and then I'll take your question. Till then I'll take the questions which are in the Google form, and others also please start writing questions so that I can see. So first question is from Shafia, low milk supply. So for low milk supply, what you need to do, you need to always start creating demand first. So if your baby is already breastfeeding, then first breastfeed, then you can pump. Second thing is, if your baby is not at all coming on the breast, then you start creating the demand with the pump. Along with that, you need to take good water intake. You should work on improving the flow by doing oil massage and a warm compress. Take galactogogues medicines like lactomagic powder and Morico tablets. Along with that, you just need to keep the baby skin to skin and keep checking the baby's weight gain. All these things are important to increase the milk supply. Next question is from Priyanka, says low milk supply with latching issue. So low milk supply I have already answered. For latching issues, what I prefer is the baby should be doing a proper hold, and how to have a good hold. As you are bringing the baby towards the breast, just keep a proper pillow so that the baby's height can be increased on this. You don't have to go forward to latch the baby. When you're latching the baby, just suppose you have to breastfeed from the left side, then hold the breast in U shape from below. Get the baby from by the other hand, and when you are getting the baby towards the breast, just make sure that the nipple should tickle on the baby's upper lip. Once you tickle that, then the baby will open a big mouth, latch the baby. While the baby has latched, don't remove this hand, keep it here. You can support your hand with a small stool and then keep holding the breast so that the baby can maintain a good latch. All these things you need to follow for a proper latching technique. So this latching technique is called as cross cradle hold. Next question is mostly it is latching and low milk. So for latching and low milk, I have already answered. Pranita says low weight gain from second month. So if your baby is not gaining weight properly, and if you're on exclusive breastfeeding, then what you need to do after every breastfeeding session, just see the color of the milk. If the color of the milk looks thick white, that means the baby is not emptying your breast. In that case, either you pump for 5 minutes or hand express this milk and give this to your baby for every feeding session. This will increase your baby's weight. So Rinki, you also need to follow the same thing if you are feeling that the baby is not, sorry Rekha, if your baby is not gaining weight, you need to follow this. Although your baby is 3 months old, which is the growth spurt. During growth spurt, the baby's demand increases and sometimes they don't want to feed properly. So you need to work on that. You need to give the baby frequent feeding. And if the baby is not gaining weight because of the growth spurt, it will be okay by next week. So just follow that, and otherwise just after feeding session, just see the color, and if it is thick white, express that milk and keep giving it to the baby. So Rinki says low milk supply diet, ma'am. What is diet? What are you asking question? Just put a proper question, Rinki. What do you want to ask? Next question. Mostly mothers have written low milk supply. Piali, Eman, Varsha, Shame, Apurva, Himanshi. Himanshi says breast refusal and not feeding in awake condition. So Himanshi, your baby would be like 3 months above. That's why the baby is not feeding in awake condition. So that what you can do, and during the daytime when the baby is awake, just keep the baby skin to skin with you. Don't try to push the baby on the breast. When the baby is little sleepy and when the baby is like sleeping, that time you can try to put the baby on the breast. Once you keep the baby skin to skin with you, that will help your baby to get with a proper bond with you, and the baby will start latching also. For the time being, you need to create the demand by regularly pumping. Next question is from Sumaira. Pain during breastfeeding. So pain shows that your latching is not proper or the flow is not good. That's why the baby has to suckle strong, which is causing pain to you, or the supply is less. For latching and for supply, I've already told you. If you are facing the flow issues, just do oil massage and warm compress. And Arjita, low milk supply already answered. Harshini already answered low milk supply. Gauri, low milk supply already answered. Srihasti, acid reflux in baby. So if you are facing that the baby is having acid reflux, that means it is either because of the formula milk or either you are overfeeding the baby. So give frequent feeding but small amounts, that will not cause acidity to the baby. Next, Anjali, latching issue and low milk supply, already answered. Tanu, can't relactate. Why can't relactate, Tanu? You can definitely lactate. Just follow the tips of the increasing milk supply and you will be definitely able to get your milk supply back. Yeah, breastfeeding baby completely on formula milk. All these mothers who have written low milk supply, just follow the different protocols which I like tips of which I have just told you. Otherwise, you can contact our helpline team and get your consultations done with either my doctors or with me. Next question is okay. Next question is from Seema. I have almost completed 15 days of the treatment. Please help me with the answer of below question. My baby's now formula is reduced, but breastfeeding time is still not getting reduced. Please suggest what to do. So in this case, what you can do if you want to reduce your breastfeeding time, make sure that the latching is proper. If the latching is not proper, then it might have a issue. So if you are already in under our treatment, just make a latching video and send it to the helpline number. They'll check the latch and will advise you what to be done on increasing the on improvising on the baby's latch. Next question is from Stuti. Baby is on katori spoon feed. So whenever tried latching opens mouth only for spoon, and even if tries to wide open mouth, baby latches only on the nipple. So it would be the way that either the baby's mouth is very small or you are not holding the breast properly. When you have to bring the baby on the breast, just press the breast so that the nipple pouts outside and the areola is also visible for the baby. So when you're getting the baby on the breast, just make sure the baby opens a wide mouth and latches. While you are latching the baby, don't let this hand loose on the breast. Keep it tight, and then once the baby latches, then don't remove this hand. Keep holding the breast so that the baby learns on latching deeply. Next question, Srijan, latching issue. Okay, answered. Mostly a low milk supply. I don't see any new questions there. Shilpa says my baby disturbs during night for feeding multiple times. So this might be because of less milk or the baby is going through a growth spurt or because of the supply issue. So all just follow the tips and tricks which I have just told you. The milk supply will start increasing and you will not face any issues with that. Okay, so next question is from Sri Hasti. Ma'am, is GERD or silent reflex common babies? How to handle it? No, usually it doesn't happen. Some babies have difficulty with formula digestion. So for them, it happens. If it is happening, just whenever if you're breastfeeding the baby, just hold in upright position and try to feed the baby. Give small, frequent meals instead of giving one time of more amount. This will help to resolve this issue, Sri Hasti. Rekha, thank you, ma'am. You're most welcome. Sri Hasti, my little one has just entered 4th month. Okay. So just follow what I have just told you right now. Rekha, one more question. Breast is so soft. Is it's any problem? No, Rekha. Please don't worry about the soft breast. So soft breast doesn't mean that you have less milk. Hard breast doesn't mean that you have lot of milk. So softness or hardness of milk doesn't mean that you have like it has got no relationship with milk sufficiency. It is extremely okay if the breast is soft. Hardness of breast is or leaking of breast is due to the hormonal reflex or the oxytocin reflex, which is not common for every mother. Some might feel it for first 6 to 8 weeks, and some might not at all feel it. So don't worry about the hardness of the breast or the softness of the breast, Rekha. Okay. Next question is from Soumya. Low milk supply. I'm using medicines. I'm giving formula with breastfeeding. I want to give exclusive breastfeeding. If baby breastfeeding, she drinks 2 minutes, goes to sleep, what to do? So if your baby is sleeping after 2 minutes of feeding, then you feed the baby frequently, but you need to pump the milk after the baby goes to sleep. You need to follow this pattern and work for the latching. So if you are our already patient, just send your latching video to the helpline number. They'll work on that. They'll let you know on what all things you need to work. If the baby is sleeping on the breast, I think you're not doing massage and the compress properly, Soumya. So just let me know, is your protocol followed properly? If you're following everything, just talk to the helpline team and send your latching video so that they can guide you on about how to improve the latching. Suti, baby is 22 days old, is on katori feeding. Are there any other ways of feeding other than katori feed? Yes, you can do with a Paladai feeding, or you can also do a syringe feeding. So you can have the syringe, remove the needle and fill the milk with that and slowly let the baby suckle. So keep pushing the milk slowly and let the baby suckle the milk from that. Okay, Steve? Next is Rinky, diet for low milk supply. So basically, diet alone will not increase your milk supply. So if you're a breastfeeding mother, improve protein. So if you're a pure vegetarians, try to include sprouts, protein like this milk and milk dairy products like paneer and soya bean and all these things will improve your milk supply regarding like protein intake. If you're a vegetarian, take at least 2 eggs per day. If you're a non-vegetarian, take 2 eggs per day and have thrice or 4 times of non-veg in 24 hours, in 1 week. That will improve the protein intake in your body and will improve your overall protein content in your body and will improve your milk and also the composition of breast milk. Plavita. Hi ma'am, should we feed the amount of express breast milk as per the amount mentioned in the formula pack? No, no, not like that. As I don't express that amount yet in 2 to 3 hour window. It's fine. You don't need to follow that kind of things like how much formula is recommended. Don't go with that. Just keep the amount, whatever you are producing and see the weight gain of the baby. If the baby is gaining weight properly, you don't need to give that extra amount of milk, Plavita. Okay. Rinky, charges, of course, ma'am. What? So, I'm not able to understand, Rinky, what you're asking. So, if you're asking about the consultation details, you can contact the helpline team. You might be having their number. If you don't have them, I'll just put that in the chat box. So, it is, just give me 1 minute. You can contact the helpline team tomorrow for if you want to take the consultation, Rinky. Otherwise, what you have written, I am not clear about your question. Just put it in the chat box again if this was not the question. So I'm just putting the number again. So the number, just a minute. I'll just answer your question, Soumya. So the number of our helpline number is, I'm also talking like repeating the number. It is 93690 93690 37490 37490. Contact them. They are available from 10 a.m. to 6 p.m. Contact them tomorrow. Who asked? Sorry, I mentioned it to somebody else. I'm putting it in the chat box. Next question is from Soumya. Is pumping increasing the milk supply? So you need to first breastfeed and then only pump. So pumping will create extra demand for your body to create more milk. Directly, it is not going to improve. You need to also follow the other processes like water intake and all the other things with that. Rinky says, thank you. You're most welcome. Deepti. Ma'am, if I have got my periods, will it affect my milk production? So during periods for first 3-4 days when the bleeding is too much, that time you can feel that the milk supply is little less because your body is going through a nutrition deficit. A lot of bleeding will make your body to conserve the nutrition for you. So for 3-4 days, you might feel the milk is going down. But after 3-4 days, you will get your milk supply back on track. So don't worry about it. Keenal. My baby sleeps within 5 minutes every time I breastfeed her. Why is my milk not coming in? So there might be three things with that. Either the baby's already full with formula regularly, so the baby is not interested to feed. You need to check with that. So if it is happening, we'll start reducing like 10-15 ml and see if the baby's latch improves. That means it's it is not about the milk. It is about the baby's dependency on the formula. Second thing is if the flow is less. So for flow, do oil massage and warm compress. This will improve the flow so the baby can have the milk properly. Third, maybe the latching issue. If you are latching the baby on the nipple, the baby will not get milk properly and the baby will sleep. And the last thing is if the supply is very less. So just see, Hinal, what is the issue, underlying issue, and accordingly just work on it. Okay. So I don't see any new question here. If you have any question, just let me know in the chat box. Otherwise, we can just Rinky, ma'am, pumping is helpful in increasing the breast milk. I have just answered. So alone pumping. So if your baby is not at all coming on the breast, then you pump. But if your baby is already coming on the breast, then first breastfeed, then only you pump. Bhavna, my baby is not even latching. So if your baby is not latching, just keep creating demand so that the milk supply improves. Rinky says, okay, ma'am. Okay. Stuti, ma'am, my nipples are not enough protruding. What can be done? So don't worry. You don't have to feed the baby with the nipple. You have to feed the baby with the areola. So hold the breast in U shape from below. Press the breast. The areola will be pouted out and the baby will hold the areola. You need to do oil massage and the warm compress so that the breast is soft and the baby can latch on the breast properly. Okay, Stuti? Piali, my baby is 3.5 months old. Try to relactate. How long it takes? So that will depend, Piali, what was the milk production initially. If the milk came good, but then it dropped, then your milk supply will improve faster. If the milk was already low from beginning, it might take little more. But what I have seen, usually people take around 45 to 60 days to come back to the exclusive breastfeeding for relactation. Bhavna, I have flat nipples and heavy breast. Don't worry about the flat nipples. Oh, you have to feed the baby with the areola. Have you ever seen a burger? Burger is already flat, but still we can have a big bite by pressing the burger and opening the mouth wide. So the same process, if you have a flat nipple, that also is okay. You need to hold the breast from below and you have to make the baby open a wide mouth so that the baby can latch properly. Stuti, thank you, ma'am. You're most welcome, my dear. Okay, so I don't see any new questions. I hope we are done for the day. Okay, so any of you who have any questions, you can drop into the helpline number if you're already connected to the team and you have already taken consultations from us. If you have not taken, you can come next Friday. We'll have again question answers and we'll discuss all these things. And that's all. So I see new questions. Rinky, ma'am, my baby is 2 months. Possibility in increasing breast milk? Yes, definitely. Bhavna, my milk supply is also low. So I've already answered about how to increase the milk supply. If you joined late, you can watch the recording. So this recording will be uploaded on YouTube tomorrow or day after tomorrow. And that way you can watch this recording. And my YouTube channel is in the name of Dr. Tanima Singhal. You can go to the YouTube and subscribe to the channel. So all the new recordings and the old recordings will be there. You can watch them. Hinal, does nipple shield decrease milk supply? No, it doesn't decrease the milk supply. It helps to latch the baby. So you don't have to depend on that. If you're using a nipple shield, latch the baby, but after that you pump and few days, just once the baby is on the breast, just try to remove the nipple shield after few days. This will get your baby back to the breast and continue with the pumping so that you maintain the demand with that. Because with nipple shield, the baby is not able to like empty the breast. Rinky, ma'am, please give the YouTube link. Okay, let me see if I can find it right now. Just give me 1 minute. If you go on YouTube and you type Dr. Tanima Singhal, you will get my channel, but let me find if I can get it. Oh, that's easy. Okay, I've got the link. Let me just share it to you. Any other questions you can put in the chat box till then? How to share it? Okay. So who was asking for the link of my YouTube channel? It is there in the chat box. All those who don't have my YouTube channel, I have put it in the chat box. You can check it. रिंकी एक बार देखो जा रहा है कि नहीं यूट्यूब वाले पे एक बार चेक करके मुझे बताओ और उस पे जा करके उसको क्लिक करके सब्सक्राइब करके बेल आइकन दबा देना जिससे आपको वीडियोस के रेगुलर अपडेट्स आ जाएंगे Plabita, ma'am, in an average, how much milk is enough for a 3 month baby? So, Plabita, what you need to do, you need to check your baby's weight. If the baby should gain around 100 to 150 grams in a week. So if the baby is gaining 100 to 150 grams, whatever amount of milk you are giving to your baby is sufficient. If the baby's weight gain is more than 100 to 150 grams, that means whatever amount of milk you are giving to your child is more. If your baby is not gaining 100 to 150 grams, that means the amount of milk which you are giving to the baby is less. I know we have to watch the weight gain, but for just from your experience. So this is the correct way, because every baby is different. So we can't have a like a fixed amount of milk for the baby. It is basically we need to check that what is the weight gain. So for a 3-month baby, I would prefer having around 150, 100, or like that like 3-month plus. If the baby is less than 3 months, then it would be around 150 to 200 grams per week. Okay. Most welcome. Most welcome, Plavita. Soumya, my pediatrician suggested me in whole day. You took some time to give breastfeed. I followed it. My baby weight gain is not good at that time. So obviously, see, always remember breast milk is in two parts: fore milk and hind milk. Fore milk is the milk which comes first. So that is little watery, and that doesn't have much fat, but it has got very good immunity factors. The milk which is at the back, which is hind milk, which is little thicker, that is loaded with fats, which increases the baby's weight. If the baby's latch is shallow, or the flow is less, then what happens? The baby only drinks the fore milk and goes to sleep. So in that way, that's why the baby doesn't increase the weight. So in your case, if it is happening same way, you latch the baby and then you pump by seeing the color. If the color looks thick white, you pump for 5-10 minutes. Give this milk to your baby. The baby will start increasing the weight also, Soumya. Okay. Rinky, ma'am, for 2-month baby. For 2-month baby, it should be around 150 to 200 grams per week, Rinky. Okay. I hope that's all enough. Soumya says, thank you, ma'am. You're most welcome, my dear. Chalo. So that's all for today. Take care, everyone. We'll meet you again on next Friday. Bye-bye.